Hi guys, hi everyone. So today I am going to discuss a very small topic which is a part of your oral pathology as well as your prosthodontics. Okay, so the topic is burning mouth syndrome. This can be asked in a short note. You can be asked for 5 marker. Okay, so let's start with the topic. So what do you mean by burning mouth syndrome? See, burning mouth syndrome means it is a burning sensations in the mouth, okay, which is it is in that part of the mouth which is in contact with the denture. So there is not any kind of change in the visibly change in the mucosa, but there is some burning sensation. Okay, patient will come to you and complain ki I am having some burning sensation. You will look for it, but you won't be able to see for the any kind of visible change. Okay, so mucosa is clinically healthy. So if you will try to see, you will see that the mucosa is clinically healthy. So it is clinically healthy. And other point which you have to remember, that it is seen more commonly in females. Okay, more than male, it is seen in females, and that too at the age of 50. Obviously, because denture is mostly worn by the older people, so it is seen in 50 years of age. Now, what are the clinical features which you will see? So burning sensation mostly affect the tongue, lip and palate. So patient will also say that there is some burning sensation in the tongue, in lip and also in the palate. Okay. So this is basically the definition and some of the clinical feature. Next is the etiology, means what is the cause? Why is it happening? Oh, so what is the etiology? Etiology is basically it can be local cause as well as a systemic. So in local cause, it can be due to some kind of trauma. Okay, so some kind of trauma. Why does the trauma occur? Trauma can occur from this ill-fitting denture, means whatever denture you have given to the patient that was not properly fitting into his or her mouth. That's why the patient is complaining for the burning mouth syndrome. Next, it could also be due to dry mouth or xerostomia. Dry mouth means the salivation is very low, means the flow of saliva into the mouth of the patient is very less, due to which the patient is suffering from dry mouth. Okay, so that's why also it could be a burning mouth syndrome. Okay, now could you find out what could be the possible reason because of this xerostomia? Why is it leading to this burning mouth syndrome? Can you think of the reason? Okay, I'll tell you. The reason being is whenever the saliva is not flowing much, so what happened? The we normally, have microorganism in our oral cavity. So whenever the saliva is there, it helps in flushing out these microorganism and it keeps our oral cavity healthy. Okay, but when the xerostomia is there and the saliva flow is less, so what happens? These microorganisms, they become more active and they cause problem in our oral cavity, like candidiasis is seen and many other problems. You can see dental caries will be there and periodontitis and all that. So that's another topic, but for now just remember that in just due to the dry mouth also there is some problem. Next is geographic tongue. I am sure you must have read about it in your oral pathology. What is geographic tongue? Geographic tongue means there is a map like lesions on the tongue. So that is called geographic tongue, and it is also called erythema marginatum. Erythema marginatum means there is map like lesions on the tongue. Okay. Next is tongue thrusting. Tongue thrusting habit is seen in people where in they try to push their tongue against their teeth. Okay, so that's why it is tongue thrusting. In that case also you can see this burning mouth syndrome. Next is gastroesophageal reflux disease. What is this? You must have read about it in your general medicine. What is gastroesophageal reflux disease? It is basically a problem of the sphincter, okay, or due to which this content of your stomach is regurgitated back into the oral cavity, or it causes some kind of acidity. So because of that also there can be this burning mouth syndrome. Next is sensory nerve damage. If there is some damage to the sensory nerve, it can also lead to the burning mouth syndrome. So in local causes, you have to remember these 6 causes. It can be due to the ill-fitting denture, due to dry mouth, which can lead to a lot of problem in the oral cavity. Then it can be due to the geographic tongue, due to tongue thrusting, due to gastroesophageal reflux disease and sensory nerve damage. Okay, I hope you will remember these points. They are very simple ones. Okay, next is systemic. What are the systemic causes? Systemic, there can be some deficiency of the vitamin. So what sort of vitamin? Vitamin B12. Okay, next is it can also be some immunologically mediated disease like Sjogren's syndrome, which you must have read in your oral pathology, in which you have dry mouth, xerostomia. Okay, there is xerostomia, keratoconjunctivitis, as well as rheumatoid arthritis. So it is basically associated with these three features now, and it is basically of two type, primary and secondary. I hope you remember this. If you don't remember this, then please let me know. I'll make a video on that also. That's a very simple and very basic and very, as well as very important topic. It has been asked in your theory exam as well as in your vivas. So I'll share with you this topic also. Okay, next is psychogenic disorder. There can be some problem in which the patient mental problem is there. Okay, next is psychosocial stress. Then it can also be due to diabetes mellitus and due to menopause. Menopause means whenever there is stoppage of this menstrual cycle. So this is about the systemic and local causes. I hope you will remember these causes. They are very simple ones. This vitamin B12 deficiency due to some immunological problem, due to psychogenic disorder, diabetes mellitus, menopause. Okay, just remember these. Okay, so what all problem will the patient have? They will have the dry mouth, already I have told you. Then there will be increased thirst. Obviously when the mouth is dry, the patient feel more dehydrated, so there will be increased thirst. Next, there will be altered taste sensations. Okay, so there will be altered taste sensations. Okay, because you know what happened whenever we have this saliva in our mouth, so all the components of the food, they get mixed up with the saliva and they give us taste. I mean, the kind of taste you have is just because of the dissolution of with the saliva. So there will be altered taste sensations. There will be bitter or metallic taste. Obviously because of the altered taste you will have some metallic taste. Then there will be anxiety or depression. Okay, so this is about the clinical feature. Next is treatment. How will you treat this kind of patient? You will give antidepressant because the patient immune system is active. So you will try to depress it. So you will give antidepressants. You will give vitamins or dietary supplements because it could be also due to the vitamin deficiency. So you will try to give the patient with supplements. You can also give the analgesic sprays or mouthwashes. Okay, so this is the treatment. This is a very brief, if you really wanna gain some more knowledge about this, you can definitely go to the book called Nalla Swami. You can read it from there, or you can also read it from the oral pathology book, which is the Schaeffer's, in which it is given in more detail. Here on I have just explained you briefly, which you can write in your exam. If suppose you were not able to read that, and you had to answer in your vivas, and so you have some basic knowledge about the topic. So that's why I have made a very short video. If you really want to learn more about it, then you can definitely read from those books. Okay, thank you so much, and if you really like this, then please hit the like button and keep watching for the next if you want me to make any other further video, any specific topic, you can definitely tell me. Otherwise I'll keep on sharing all the videos. Okay, thank you so much.